Hi, everyone. This is Bob Dietrich. And, I'm so excited for this interview today. Welcome to the ADHD Toolbox. We're going to be talking to Dr. Stephen Porges. Dr. Porges is the author of the Poly Vagal Theory, which you're going to learn about here. We interviewed Dr. Porges on the last Toolbox and got pretty deep as far as what the polyvagal theory is and understanding the neurology and how your body's structured around ADHD. And we're going to do that again today and maybe go even deeper, hopefully. Dr. Porges, welcome to our show. Thank you for being here today.
Thank you very much for inviting me. It's going to be a pleasure to have another dialogue with you.
Yes. The last one was so fascinating, and I could have talked to you for hours because, I have experienced anxiety myself and even panic in some cases in situations where, experiencing my brother's passing and understanding why that's happening with me internally was such a big help. But, these states of anxiety are states that people with ADHD are in constantly. And we would love to understand what's going on there so we can understand how to better heal that. So let's jump right in. And I watched an interview of you last night talking about the polyvagal theory, and I thought it was fascinating. And you talked about, I think it was 3 parts to the theory itself. And can we talk about those 3 parts of the polyvagal theory?
Sure. What we'll talk about is really 3 different physiological states or circuits.
Right.
And the 3 are really, you have a very ancient shutting down or withdrawing state where you basically lose consciousness. And if you don't lose consciousness, you dissociate. So people under severe fear, it's your last defense system. Now, as I talk about these states, don't think of them as intentional or voluntary states. Our body goes into those when the body and the nervous system evaluates risk. So under severe risk of life threat, you may just shut down and dissociate. And I want you to think about a child within a classroom being yelled at, and they may functionally dissociate and go someplace else in their mind. So the ancient physiological circuit is really to pass out or to appear to be dead. But over time, with experiences, our nervous system gets smart. And so we maintain a level of consciousness, but without awareness. So being yelled at, our body may literally freeze in space, and we might lose contact with listening or being able to extract the meaning of, let's say, a teacher yelling at them or telling them to respond, and they are not even processing the language. So this is the most ancient physiological circuit, which is really a shutting down, immobilization, withdrawal. It's primarily a life threat system. It's very ancient. It's really occurred evolutionarily in the most primitive vertebrates. But then we have a newer one that we're all familiar with, which is our fight-flight system. And this one tends to be really associated with really what your prologue was about feeling anxious or the chronic anxiety that an ADHD child may feel. But within polyvagal theory, we don't call it anxiety. We just say your body's in a physiological state that is primed to mobilize, basically primed to run away or to fight. It's not like you're anxious and you don't need to be anxious. You need a label for how you're feeling. And that feeling is that you're uncomfortable in the place that you're in, or literally uncomfortable in your skin, and your body wants to move. And now we start describing many of the features of a child with ADHD. But we evolved as mammals with this very remarkable modification of our autonomic nervous system. And this modification linked the muscles of the face and head and breathing to the neuroregulation of our visceral organs, so that when we can look at other people and feel safe with them, make social contact, or we hear we hear a prosodic, meaning a voice that is melodic and reassuring, we start changing our physiological state. And this actually evolved from very early mammals, because when early mammals evolved, they didn't have speech, they didn't have language, but they communicated their bodily feelings to others by the intonation of their voices. So a good clue about working with ADHD children is to listen to their voices. Are their voices higher pitched with less prosody? And what would happen as an informed parent or teacher? You slowed up the way you spoke to them and your voice became more melodic. You're sending cues to their nervous system that's okay to feel safe and to turn off fight flight. So the newest circuit is this what I call social engagement system, but it's linked to a neural regulation of our viscera and enables us to literally feel safe in the arms of others.
Got it. Got it. So it's feeling safe, fight or flight, and this shutdown.
That's
And
right.
people are using this term fight, flight, or freeze now.
Yeah.
And the freeze part is the shutdown part you're talking
Well,
about, right?
it's a wonderful question because freeze is almost like a hybrid. Because the real shutdown is literally you pass out, or you might hear stories of children that were so frightened
Hmm.
that they passed out, or they defecated, or they urinated.
Hmm.
That is part of the shutting down response. But if you can maintain the muscle tone and just kind of like disappear with still maintaining enough muscle tone, that's freezing. So freezing has a degree of muscle tone, and to have muscle tone, you need a sympathetic nervous system stimulation, which is part of fight flight. So it's a hybrid between shutting down and fight and flight.
Hmm.
But it's very functionally adaptive because if you didn't freeze and you shut down,
Hmm.
shutting down is potentially lethal because you're not getting enough oxygen to your brain. That's why you pass out and hit the floor. But freezing, you have enough as a neural regulation of oxygenated blood to basically support your life.
Understood. Okay, great. Another distinction that I think is important, and when I saw it on the video, you were talking about the brainstem
Yeah,
nervous system being in a kind of a upside down triangle.
yeah,
Can you explain that and how it goes from your extremities to your
yeah.
brain and how that operates?
Okay, first of all, the brainstem being that little apex of that inverted triangle is not really large, but it really is the control center where everything coming up from your body goes into your brain and stuff from your brain goes into your body. So, in a sense, being small, in a way, it's saying it's not that complicated. So, in a sense, our body elects or selects almost automatically different physiological states to promote different behaviors. But focusing on your question, our brainstem, that lower part of the brain, is really our surveillance system of our body. So it's monitoring the function of all the bodily organs. Now, in the world of ADHD, what you start seeing is comorbidities. You start seeing children with digestive or gut pain or gut problems.
Mhm.
This is part of the same autonomic system, which is supporting fight flight, is doing it at greater cost. It's doing it in interfering with what would be called homeostatic processes. So as we mobilize to defend ourselves, we are turning off what our body needs to do to take care of ourselves. We do fine as a species by turning this off for short periods of time.
Mhm.
But when it's in a chronic state, like for many individuals with ADHD, then there's a price to pay, and that is you start getting comorbidities. But they're not really comorbidities; they're part of the same syndrome, and that is your body is in a state of fight flight, not in a state of safety.
Got it. Got it. And so these comorbidities, for those of you who may not understand that, it's existing of two different symptoms at the same time. Is that
Yeah,
like
right.
right?
So a child with ADHD may have gastrointestinal problems, might have gut pains,
Yeah.
might have oscillating diarrhea and constipation.
Mhm.
And that would be because the enteric nervous system, the nervous system of the gut, is not getting signals of safety. And when our nervous system gets signals of danger or life threat, it makes certain adjustments. It turns off our digestion.
Right, and which is crucial, right? Because we're creating a large percentage of our neurochemicals in our gut.
Well, we're not just creating the neurochemicals in our gut, we're doing our healing and our restoration. So, and we're, in a sense, uh, dealing with our immune system as well. So, the issue is if you're healthy, your nervous system cannot be focused on defending to external stimuli. And that's what this is really about. So, when you shift into fight or flight, your nervous system is really focusing on external stimuli and not dealing with its own bodily needs. the metaphor I use is supporting health, growth, and restoration. But in doing that, we're also optimizing other aspects of the human experience, which means that we're safe to be touched, we're safe to come close to others. We're not hyper vigilant, which is really a characteristic of ADHD, and we're not overly, aggressively defensive.
Got it. Got it. So many directions to go here, but let's go here. Let's go to this question. I know in our interviews with all the different experts and doctors on ADHD that fight or flight is a big deal. It's one of the biggest issues, challenges with people with ADHD, especially children. It's the cause of them reaching out, acting, hitting, and being aggressive and their hyperactivity. Would you agree with that statement?
I would make another state that if we're in the state of mobilization, which supports fight or flight, we have a negative bias to the world. We see the world as dangerous. And I use a term that I call neuroception. And neuroception is our nervous system making those decisions for us. It's not conscious awareness. So we don't want to tell an ADHD kid, relax, you have nothing to be afraid of. You're not talking to the nervous system, you're talking to a very high cognitive function. And of course, that child would like to be calm, would like to be loving, would like to feel safe, but the nervous system isn't convinced. So this really shifts the paradigm. It says the paradigm moves out of behavioral regulation models, or ABA, and out of cognitive therapies like cognitive behavioral therapy, CBT. It moves to being informed about physiological state, being informed that our physiological state is a major mediator of the potential of being oppositional, the potential of having a low threshold to be negative. So coming back to the basic question, if you're in a physiological state that you initially were calling anxiety, but I'm going to call basically mobilization supported by sympathetic nervous system, you're going to see the world as a very negative place, and you're going to be reactive.
Got it. And so you're going to be in fight or flight more often.
Yeah, and you're going to misinterpret gestures of inclusion, where people will be coming out to you to try to, in a sense, be part of your world. You'll see it as a threat and react to it. So oppositional behavior becomes one of these features that starts popping out in ADHD, as well as frustration, which is just another form of oppositional behavior.
Got it. So if you have, let's say you have a child, or even you're an adult, you have ADHD, you're in fight or flight a lot of the time. I guess two questions come up. Why are you in fight or flight most of the time? Was one question. The other question is, what do you do about it?
Okay, now you're asking really the important questions. Let's start with the why. The why, we get a good clue that the body has, in a sense, retuned its autonomic nervous system. And that's how we start figuring out why and where did this occur from. Was it due to a traumatic event that the nervous system now interpreted as being dangerous and can't get out of it because the body is kind of stuck there? Is it a function of the child having a high fever, which retuned the autonomic nervous system to be more defensive as well? So medical illnesses, as well as, let's say, threats to the body itself, can do a retuning of the system. So we start to, in a sense, be more, the word that's floating around is trauma-informed, but let's be really specific. We start to become more informed that the clinical history of the child, even with the best intentions of medical care and parenting, might have triggered the physiology or the nervous system of the child to be more defensive. And we want to be really careful, because this is not a model of blaming or getting parents or physicians feeling, or therapists feeling, in a sense, responsible or guilty. We just want to retune their attention to start asking different questions, like your questions, why? Now, there's also the possibility that there are such a range of individual differences in the world, and some people have a lower threshold to be reactive.
Right.
But having that lower threshold doesn't mean that they have to stay in that state. So that's part of what we start to learn about the individual. So the first one is this appreciation of the physiological state of the child, and understanding that that physiological state could have emerged early in life from early perinatal difficulties early in life. It could have occurred due to psychological disruptions, moving a school and going into a place where the child didn't feel safe, and the body just flipped into a much more hypervigilant state. We don't know the history, but a clinician or a teacher can get a better sense of this, and they can also see whether there are windows of opportunity where that nervous system now appears to be safe and welcomes interaction. So a well-attuned educator can see when a child is no longer in that defensive state and now leverages that to expand the range of interactions that that child can have. So that's the first point, was what are the mechanisms? And the second point is, what do you do about it? And I start to get into that with the teacher. And that is, the first one is, what do you do about it if it's your child or your student? And that is, you start getting an understanding of what features trigger safety and what figures trigger more fight-flight behaviors in the child. The other part all of us have to be acknowledge is that if you've been triggered into the state of fight-flight and you're chronically in this anxious state, you become hypersensitive to certain cues in the environment, like noise, low-frequency sounds, because through our own evolution, when a low-frequency rumble are predator sounds. And guess what mechanicals and air conditioning systems and elevators and trucks and vacuum cleaners present? They present these low frequency sounds. And these are functionally triggers to that nervous system to be more defensive. So we have to be aware of that. And we can't just say that if I can deal with those sounds, why aren't you? So we have to understand that there's a retuning. When the autonomic nervous system retunes to defense, there's also a retuning of how our middle ear structures work. So they become now tuned to pick up low frequency predator sounds, and they are no longer tuned to extract human voice in background sounds. And now you know that you already know what I'm going to say next, because what are the other symptoms of ADHD? Often speech and language development gets slowed up. Mm-hmm. And that's because they're not hearing the ends of words, which are at higher frequencies. Their nervous system has now retuned and has become excellent in detecting predator. But that means it's going to have difficulty in extracting the meaning of voice, in the sense of extracting words, and intentionality of voice.
Yeah, that is an amazing insight right there. And if you didn't hear this, rewind the video and listen to it again, because it's so important. It's like the fight or flight system, when it's on, and if your kid is chronically in fight or flight, you're going to have challenges with speech and language, because it's their body's retuned to, these blinders on and focusing on
the body is doing something exceptional, but it's now adapted for defense.
Right.
So rather than getting angry at the child and the child's body, just kind of marvel at how efficient it is in detecting predator. But it's doing that at a great cost, where it can't process speech or understand language or intention. Right. Now let's move into what can you do, yes. Which is really
Before we go there, I have a couple more questions, because I want to set this context a little deeper. With the first question is around babies. When babies are born, are they in a fight or flight state, and then they kind of develop out of it as their brain develops, or what's happening at that young age?
Well, babies are remarkable, because a full-term baby has the capacity to express a type of social engagement behavior. So that's, in a sense, it's very low level in the brain, but it's enough cues to the parents to feel that they're in love with their child. Right. So the baby's face, the baby will suckle, the neuroregulation of suck, swallow, and breathe is the same neuroregulatory circuit that's involved in social behavior. So when babies have that at birth, they are already able to calm their physiology through ingestion. Now, as we get older, we use the same muscles to calm our visceral, our bodily state, but we do it through talking, through smiling, and through singing, or through listening to a melodic voice. So a baby comes into the world already tuned to understand the importance of a melodic maternal voice. And mothers do this almost reflexively. So they calm the baby with the melodic voice, because melodic voice literally fits a code that we were born with. It's a code that says this is safe.
Got it.
So once you know that, you now have a portal into triggering physiological safety or states of safety in humans by using prosodic music. Now, the classical composers understood that because that's what they did with their first movements. Love songs or love ballads, people knew that.
Mhm.
So whether it's music or how we speak, our nervous system knows what's safe, and we often have these gut reactions where we say, I didn't like that person, and someone will say, well, was it something he or she said? And they say, no, I just didn't like that person. And when we deconstruct that, what we're really saying is the social cues from facial muscles, from vocalizations, from gestures, were not fitting the template of safety in the other person.
Got it. Got it. So let's jump back into the answer that everybody's waiting for.
Well,
Yeah, go ahead.
Okay. The answer is that we have to convey cues of safety to the child or to the nervous system. And the simplest portal is through acoustic stimulation of prosodic voices. The other link to that is creating educational and home environments that are not bombarded with low frequency predator-like sounds. So school systems and the designing of their rooms, just like intensive care units, are all about surveillance and cleanliness. So you want to make sure everything's clean. And there's less of a insight into the fact that the mechanicals of a building can be very disruptive to a nervous system that has a history of reacting to predator.
Got it.
So the first thing is remove those background sounds. And what people with ADHD or parents of kids with that know, that if they take them to shopping malls, they may go ballistic. They may lose control. And you already know that there are certain environments, if they're noisy and lots of people around, they may not be able to regulate their behavior. And that's telling you that their nervous system is really geared to be reactive. But we need to create other environments, and these might require play. Here's the thing that's very unusual from my world perspective, and that is play is a neural exercise in which we learn over time to regulate our physiological state with another person. Mm-hmm. So we are interactive, we're smiling, we're picking up the cues, and we're creating opportunities for co-regulation, meaning regulating our physiological state with another person. And when we don't have those opportunities, we do other things that are not as advantageous to our species. We use drugs or addictive behaviors to try to regulate the state. So, and that is our valiant attempt to regulate our physiology because we don't have the opportunities of interacting with another appropriate, I use another term, appropriate mammal, because for some people it may be their dog. Right. And this becomes a major way in which we regulate our physiological state. So my hint, or the focus of our interview, is that ADHD needs to be reconceptualized as a naturally emergent property of being in a physiological state that supports fight-flight. So once you make that assumption, you now say, how do I shift that physiological state?
Yes, absolutely.
And the cues are really focused on processing cues of safety. And the cues of safety in general come from another person or another mammal. And so once our body learns or has enough experiences being safe with another, we can then start expanding that envelope. In the world of education, it's very confusing because the educational model is a model of evaluation, chronic evaluation, and the nervous system interprets that as being under a state of chronic defense.
Got it.
So,
And so going back to the way you started, we're talking about the acoustic and the sounds that are in the room. If the sounds in the room are at home or in the school environment are sounds that would cause the fight or flight to be more
yeah,
activated, then you want to change that to something more melodic. So
yeah,
like Mozart or
yeah,
that type of thing,
yeah.
or meditation music or stuff like that.
That's the theme on that. Now, I developed an intervention that is called the Safe and Sound Protocol. And that can be, if you Google that, you'll find it on the webpage for the company that distributes it. But what it's based upon, it's saying that our nervous system responds to prosodic vocalizations. So the intervention amplifies prosody, doesn't amplify volume, it amplifies intonation shifts so that our nervous system can't say no to listening to it. And so it basically says, you're now in a state of safety, whether you want to receive it or not. And the interesting part is it works extraordinarily well with most children, but if an adult who has a trauma history listens to it, it has to be used with great care and great, let's say, monitoring, because a person with a trauma history, if their body goes into the state of safety, it means in their higher order brain interprets that lower brain physiological state
Mm-hmm.
as being vulnerability. So they now become vulnerable, and now the cue of vulnerability is to become defensive. So if people with trauma histories being behaviorally, physiologically feeling safe is a cue for defense. So an insightful therapist is now able to work with that and to titrate them through this to expand the opportunities of those experiences so the body doesn't say, oh, I'm safe, I'm vulnerable, and then can actually deal with that. So we're, in a sense, learning a lot about cues of safety to our nervous system. And it's not that you can just say, okay, let's give people more cues of safety. We have to be appreciative of their own clinical history.
Got it. So to summarize that then, would you recommend to parents and or teachers that having calming music in the classroom or at home would be part of the protocol to help
Oh,
regulate their kids and help reduce the fight?
oh yeah. I would actually even recommend it. Singing and playing wind instruments or playing any form of music. I
Mhm.
would also think that any type of another thing I would also say is that team sports are also useful because team sports are both mobilization but with social engagement. And the child who doesn't function well in a team is a child who's not paying attention or can't pay attention because of their physiological state to the social cues.
Got it.
So we start seeing that music, all kinds of theater, anything that requires interaction
Mm-hmm.
is a neural exercise. And part of what we've missed in the evolving of our educational system is that we've become cognitive centric, cortical centric. We want to get more information into the child's brain. And we have forgotten about the ability to self-regulate and co-regulate their bodily states. If they could self-regulate and co-regulate, they'd be very resilient,
Mm-hmm.
and then they would be really efficient learning organisms.
Excellent. So if you're a parent out there or a teacher and you're trying to help your student with ADHD, or you're an adult trying to help yourself with ADHD, important summary here is that having those musical tones, listening to music that is calming, was one way to help. Dr. Porges also mentioned team sports will also help with the social interaction, and wind instruments because of the breathing regulation, and singing.
Yeah,
Singing also can help with the breathing regulation, right? Because it's a
yeah,
natural
yeah.
way of calming the
Right. And let me kind of clarify that. When we exhale slowly, it's calming because when we exhale slowly, there is a neural influence to our heart through a nerve called the vagus, and it basically puts a brake on our sympathetic fight-flight system.
right.
So the term say if you're kind of like overwhelmed, take some slow breaths, but it's slow exhalations
Mhm.
that are the critical part. And singing is a slow exhalation.
Yeah. So like 4 seconds in, 7 seconds
Yeah,
out, right?
yeah.
And And that will start to calm your nervous system. I've done this on biofeedback, right?
Yeah.
Where they hook you up to these wires, and they show you how your heart rate starts to calm
Yeah.
as you breathe slower, like we just said, 4 in, 7 out.
Yeah. Yeah. And it's during that out phase that the heart rate is really slowing, because the brake, this through the vagus, is actually now working.
Right.
During the inhalation, you're like turning it off. But we all know that if you hyperventilate, you're going to get yourself into a fight-flight state. So,
Right. Yeah. And so you can actually trigger your fight flight
oh,
by
yeah.
being faster.
Yeah.
So the opposite is true as well.
Yeah. That's correct.
Awesome. So amazing stuff there. I've been dying to ask you this question because I heard a term a couple months ago, and I thought, you know what, I got to ask Dr. Porges what this is, and if you know anything about it. It's called vagal tuning. And have you heard about vagal tuning? What is that, and how does it?
No, these are terms that float around, and they're really kind of derivative of things that I and several other scientists have been talking about for 40 years.
Mhm.
And as a metaphor, I assume what they're saying is increasing the vagal inhibitory action on your sympathetic nerves, calming yourself down.
Mhm.
It's another word, I would guess, for the neural exercises that I was talking about. So if you want to tune your vagus, you really need to perform certain neural exercises.
Mhm.
And then the system becomes more accessible, more reliable.
Yeah, I was assuming it meant, the vibration of singing, or
No, I don't think that's what I mean. I think I don't think. See, I think it just means accessibility and effectiveness of the vagus in calming you.
right. And so it's not the actual vibration of
No,
singing or doing om. It's
no,
the actual breathing that we just talked
yeah.
about, right?
Well, I think that's the same misconception was floating around when, as I said, people like me were using the term vagal tone, and people thought it was a sound.
Mhm.
And it was really using the word tone to reflect more of like a muscle tone. It's the system is now more effective. It's like a stronger muscle, a stronger nerve. The nerve has greater tone. So vagal tuning, I think, is within that same family of metaphors.
Got it. Got it. All right. Excuse me. So in these 70 interviews that we've done on the ADHD Toolbox, we've learned so much, and it's become so obvious that the basic foundational challenge with a child or with anybody with ADHD is that there's this flight or flight state that is constant and chronic, and it causes so many problems that that can exacerbate whatever's going on with the ADHD. And to help calm that, we've talked about doing some, well, first of all, Dr. Porges has educated us on why that's happening and how to calm it using the breath, using wind instruments, using classical music, and helping to calm the system down. These are awesome, awesome recommendations. I think I know they'll really help. They help me. I've been doing that myself for my situational anxiety, and I can see that they could be a part of a regular regimen for people with ADHD, and I think that's why meditation is so important.
Mhm. Yeah, let me interject a point. When we start the dialogue, we were talking about the three circuits or pathways in the polyvagal theory.
Mhm.
And I forgot to mention an important aspect of the theory, and that is the theory is hierarchical, meaning that the newer circuits meaning through our evolution, have the capacity to inhibit or regulate the circuits below it or older ones. So when you get this social engagement system, the facial nerves regulating the facial muscles, regulating our intonation of voice, our listening, and the vagal regulation of the heart, you're dampening the sympathetic nervous system. You're keeping it under constraints. So because the sympathetic nervous system is evolutionarily older, but the sympathetic nervous system is also evolutionarily newer than that ancient vagal circuit that shuts you down. So, which is, as I said, it's a vagal, so it's also vagal, but it's a different vagal pathways. And this gives you a lot of insight that when people are in a state of fight or flight, there is an important adaptive function to being in that state. It keeps them out of shutting down. So we have to acknowledge the adaptive value of being able to be in a fight or flight mode. It's just that we don't want to be chronically in it, and we want to get that safety circuit, the social engagement circuit recruited.
Got it. And that's another challenge with people with ADHD: socialization and being
That's
and
right.
having social skills.
Well, it's not just their social skills. They're throwing cues out to the other person, and the other person is functionally responding to a face that doesn't have the same animation as a welcoming, safe face. So the neuroregulation of the upper part of the face will be less,
Mhm.
and the intonation of their voices will be less melodic and less welcoming. So they're not sending cues to others to say, you can trust me, because they're in their state of fight flight. So you start seeing the reciprocity of being the effectiveness of being in fight flight on others.
Yeah, and no wonder children with ADHD get picked on or bullied
Mm-hmm.
because of this reason, right?
They get marginalized. And
Yeah,
when you're marginalized, what it's really saying is you're not like me.
right.
And so if you're not like me, again, this is the world we're in today, that we are basically forgetting that the survival of humans as mammals has always been through our ability to connect with others. So we need to, in a sense, enhance that capacity to connect and be welcoming to others, make others feel safe.
Awesome. Well, that's fantastic. What a great talk. I really enjoyed this, and this is valuable information because it goes to the root of what's happening with ADHD, and we need to know this stuff and how to help. And plus, I mean, a lot of times we'll deal with parents, especially or teachers that are working with children, and they don't understand it, so they get frustrated with the child and think, I think subconsciously they're thinking the child is just misbehaving or whatever,
Yeah.
and
Yeah.
they maybe even refer to it as a parenting issue, and the child can't control it. They're in fight or flight, and when we
Mm.
understand this, we can have a different level of compassion, and we can have a strategy to go at it differently.
Yes, totally agree. And I think parents end up feeling that they're responsible for what's happened to the child. We have to be very careful, because that's part of what the educational system does, is says it's you. You need to teach your child. But we need to have a better understanding that when nervous systems get locked into certain physiological states, it's very, very difficult for that individual to feel safe and interact with another.
Yes, awesome, fantastic. Well, thank you so much for all this information. I mean, we could go on, and if you do want to go on and on, we have Dr. Porges' contact information below. So I'm sure he'd be happy to reach back and answer your questions. We also have a free gift. Down below from Dr. Porges. So click on that, make sure you get that. And again, thank you so much for your time. I know you're very busy, and thank you for taking the time to speak to other people in the toolbox and help these parents, teachers, and adults with ADHD go to the next level and start to understand and really help support each other and get overcoming these challenges.
Well, thank you very much for inviting me. It's been a pleasure having our dialogue. Thanks.
Great. Thanks again. And thank you for watching this episode of the ADHD Toolbox. We will see you on the next episode.